I think it's enabled to me to think more corporately. Unfortunately, I think because we're actually trained as clinicians to start off with, and we don't actually necessarily have the corporate skills to lead or to try and spearhead an organization. The program itself has actually given us the tools to be able to do that.
I think it personally stretches you, but I think it also adds to your environment that you're working in. And I think for my own so for bringing it back into my own practice, they've benefited enormously from me having a wider perspective, a wider understanding of the bigger picture that we're working in. There have been tools and techniques that I've learned in doing the leadership course that underpin how you work on a daily basis. So the benefit in your own day-to-day work, when you look back on it, you start to realise you're using those tools all the time.
Rather than making us better leaders, I think it's allowed us to be better facilitators in a way. It's more about us being able there to help facilitate people that haven't had the opportunity to be able to step up or take time to actually take on something outside of their day-to-day work.
I've been able to help them and support them in ways that I wouldn't have known how to before, and give them an understanding of what the focus is outside of the practice, so that we're able to position ourselves in a way that we're ready for change.
Having worked as a GP for more than 25 years, I understand the grassroots level fairly well. The thing that the course helps me to understand is the wider system and how the wider system can be influenced, how it can be changed. The phrase of clinical leadership is one that I think I'd say I didn't understand very well before the course, but there are people forming the system, influencing the system, and it makes a lot of sense to me that there should be more clinicians, more people who understand how things work at a grassroots level actually involved in that. The most important thing I've learnt about leadership has probably been to be collaborative, not to see things in terms of fighting against systems, but trying to take strengths from different parts of the system, different individuals.
I think it was a bit about pushing myself as well, learning new techniques, learning new tools, meeting new people. There's lots of things that have been difficult about it and challenging about it. But when I look back on it, it's been an amazing experience.
The more good clinicians who are involved in leadership, the better it's going to be for the system as a whole and for patients.
Taking part in a similar course, absolutely do it. It would improve your working life and I think your personal life and your relationships immensely.
If you're thinking about taking part and there are resources to go on any leadership program, take it. If you have the time, if you have the energy, if you have the inclination, do it. It really is very worth it. Because no matter how much you think you know, there is always something that you don't. And there is always room for self-development.